I'm Haley,
And I'm Liz.
and today we're presenting on managing sensory and functional deficits in older adults.
So 94% of older adults in the United States have at least one sensory deficit, and 67% suffer from two or more. And since the United States has basically similar demographics as Canada, this gives a kind of an accurate representation of what Canada shares as well.
Some overall risks associated with untreated or undertreated sensory loss include withdrawal from socialization, depression, isolation, and lack of independence for the older adult, poor functionality, increased falls or accidents, increased hospitalization, overall disability, and an increased mortality rate.
So diagnosing, the most important diagnostic tool is regular hearing and vision tests by your physician. Although self-reports from the significant experience of a person experiencing sensory loss are important to gauge how profound it is, regular hearing tests by your physician are the most important.
Some effects on caregivers. Some similarities in negative effects include increased caregiver burden overall, increased stress for the caregiver, both physical and mental, and then that has overarching health consequences on the caregiver. Decreased socialization, isolation, that loss of independence as well, similar for both the caregiver and the patient. And then financial stress. So if the caregiver had to quit their job, for example, or change their income in any way to take care of the person with sensory deficits.
So some interventions for deficits include assistance in the home or community for the person experiencing sensory loss. Caregivers should monitor for progression or worsening deficit. Since sometimes profoundness is not experienced by the person experiencing it, they can witness it. Prompt assessment and diagnosis from physicians and healthcare teams. Education to the client and caregivers for furthered improvement or interventions needed, and appropriate assistive devices to aid in their sensory loss.
So exploring the client's fears around sensory loss or sensory deficits. First is a really big one of cost. So the overall cost of sensory and assistive devices for sensory loss. There's some help through the Manitoba Seniors Hearing Aid Program. It has a $2,000 deductible, but we know that hearing aids are a bit more expensive than that, usually a lot more expensive, sometimes like usually more than twice at that, but it can help. Then there's also the Seniors Eyeglass Program, $50 deductible every 3 years, and then there's also provincial compensation boards as well. That lots of older people think that sensory loss is a natural part of aging. Well, it can be. It can still they should still talk to their physician or caregiver if there's rapid changes or changes that they're not used to, or if the caregiver is noticing anything different as well. Fears around new technology, hearing aids, and all these things are changing very rapidly. The hearing aids that we used 10, 15 years ago were a lot different than the ones we use now. So sometimes it can be difficult for people if they have functional deficits as well. Maybe like the tactile response is a little bit difficult to handle. Small hearing aid batteries are tiny, so like that kind of thing can cause a lot of fear. And then also just the stigma of losing your hearing or losing your sight and just being seen as that ageist idea of, oh, you're just getting old and that's just what happens and you're aging out. But yeah, yeah.
So after kind of exploring those fears, we can kind of see what is most important to them, or see what fears are there for them most, and kind of mitigate through circumstances to where they're most comfortable and functionality is with proper use of these hearing devices. So some approaches we can do with that is an environmental approach. When you lose sight, it's hard to sometimes see rugs in your area and you don't lift up your feet as much. So maybe tacking down some flyaway rugs, or just getting rid of them overall to reduce tripping hazards. Implementing assistive mobility devices throughout the house, like grab bars, in places that the client would use them, and uses daily items throughout the house that and kind of integrate them into their routine. Charging cords, so making sure your hearing aid is charged overnight, making sure it's in a spot that they go to before they go to bed, and that they're able to charge it every night. Accurate and routine use, so making sure that it's the correct fitting for their ear. If it's not, it'll give that feedback, so that'll be very annoying, and they definitely won't want to use that. The correct type for them, making sure that their eyeglasses are the right prescription still, that things are still functional for them, and that they want to implement it into their everyday routine. It's not a hassle for them. Making sure there's independence with their devices. So like Haley said, if the buttons are too small and they're unable to see it or unable to press the buttons, that interferes with their independence. If they don't at all know how to use it, if we throw away the reader's manual on how to use it and they're not able to work through it. And then just continued support. So if it's a 50-year-old woman and she still feels great, and she doesn't want to get hearing aids, that's completely normal. And understanding that there is that stigma in public with hearing aids or glasses or canes, and understanding that there is that social stigma. And then just ensuring that their regular checkups, see if their hearing loss has become more profound, if their eyewear needs changing, if their two-wheeled walker needs to become four-wheeled, just more accommodating to their needs.
Some tips for caregivers. Reducing stimuli in the environment can help the person with sensory loss a lot, because it's very easy for them to get overstimulated. When one sense is kind of diminished, the other senses can be more sensitive to overstimulation. Another thing would be participate in activities together, for example, learning sign language or other ways to communicate through the sensory loss. Or just going to things like PT together to so that the caregiver understands like what the client is going through, and they can help them a lot more, and it just is more of a bonding experience for them as well. The fostering maintain the person's independence. So that applies to the client, but also applies to the caregiver as well. Just making sure that patience is a really important thing for caring for people with sensory deficits. So just encourage that if we're taking care of somebody, a caregiver, or talking to them through taking care of their person. The patience is important, but also taking time to be independent on their own, like have their own time, take time for themselves. Find support for yourself through counseling, support groups for caregivers. And then another thing would be to alternate caregivers to avoid burnout. You could also access things like respite or home care that we talk about more in the brochure for caregivers.
All right, and here's our reference sheet for our PowerPoint. And thank you so much.
Thank you.
We're just going to go over our brochure now.
Okay, so we'll just go through our brochure for caregivers of people with sensory loss. So this is for caring for your loved one with sensory loss. We made this kind of the focus for assistive devices because that's kind of the most important thing for caregivers and clients to have success with working with their sensory loss. And so we have assistive devices are hip. Assistive devices are tools for equipment that help people do everyday tasks more easily and safely. So examples of these were walkers, hearing aids, breachers, shower chairs, glasses, anything that helps them do things with ADLs or IADLs more easily with their sensory deficit. This is kind of like a power brochure. It's kind of backwards, but we'll just go through the first part. So financial supports for people with sensory deficits include the Manitoba Seniors Eyeglass Program that we talked about, the $50 deductible every 3 years, provincial compensation boards, and then the Manitoba Hearing Aid Program, which has a $2,000 deductible that we talked about as well. For caregiver supports, there's caregiver support groups, which is overarching caregivers, so that would be any for older adults, people with dementia, people with sensory loss, functional deficits, progressive diseases, caregivers share a lot of similarities, even if they're not caring for people with the same ailments. So it just helps a lot to hear from other people that are going through something like that. Then there's also educational groups for caregivers of people with sensory deficits. That would include them going with the client as well, and they can learn about their assistive devices together. They can learn different ways to communicate, like sign language, things like that. That would help both of them. There's also home care, OT for the sizing of assistive devices, PT to learn to work with them and progress in their getting to their new baseline, and then also respite to help caregivers reduce the caregiver burden. There's also the Canadian Caregiver Grant as well, which would help with some of the financial burden if the caregiver needed to take some time off of work or away from work or decrease their working hours in any way to take care of their person.
And then here's the other sheet. So this kind of goes over what is sensory loss. So sensory loss is one or more of the 5 senses. So hearing, sight, taste, smell, or touch. They don't work as well as they used to or should. And this can happen slowly due to age or suddenly after illness, medication, or injury. So sensory loss with aging is normal, but it should not be ignored. So some common types and tips. So hearing loss. So when dealing with a loved one who has hearing loss, it's best to speak with facing your loved one so they can read your lips, see your emotions, kind of get a general picture of what you're trying to convey without the audio. Speak clearly, not loudly. So enunciation and not mumbling is very important. Not necessarily the volume of what you speak at. Make sure you're reducing background noises. This can really muddle what your loved one could be hearing, especially like people talking in the background, traffic. If you can get to a quieter area to have a conversation, that would probably be best for them to hear you. And then make sure you're keeping, if they do have hearing aids, make sure you keep them clean and working and in perfect functionality. Vision loss, so make sure you're keeping the rooms bright and clutter-free. Sometimes an issue, whatever. Using large print and contrasting colors to make sure there's that vibrant difference so they can really see things. Make sure they're using their glasses daily and make sure that they're the correct prescription. And then for taste and smell, this can sometimes be a frustrating sensory loss as like food and familiar smells aren't working the same, and it can be very frustrating emotionally to not have the same senses. So make sure you're providing like tasty, colorful foods so they are able to somewhat taste some flavor. Make sure you're checking food freshness, making sure that things aren't expired, and encouraging good oral care. And then touch. So if you are doing baths, make sure you're testing the water to make sure that it's not too hot or too cold for their skin, removing trip hazards, and offering a gentle hand for touch. And then, did you know that 97% of older adults have at least one sensory deficit, which is also in the first PowerPoint? And again, this is a normal part of aging. Assistive devices are available to regain independence, support mobility, and connect with loved ones. So go out and use your assistive devices. Thanks!